From the Toronto Star, I'm Saba Itazaz, and this matters. It's now almost the end of year 2 of the pandemic, and it's no surprise that the data confirms what we already knew deep down. We're not exactly presenting the best version of ourselves anymore. A recent Angus Reid poll has revealed surprisingly low rates of empathy among Canadians, especially when it's between the vaccinated and the unvaccinated. Adding to the pressure is that we're all so tired of this never-ending pandemic just when we thought we were actually over it. The lack of sympathy is apparent as the debate around mandatory vaccinations to attend public spaces heats up politically and as ICU capacity and case numbers climb again. Over 80% of eligible Canadians already have their first dose, and many are eager to return to COVID-free life. With vaccines free and available in Canada, the data shows patience and understanding for those who still choose not to get vaccinated is in short supply. But just like us humans, it's also so much more complex than that, as Canada and the world faces something we've never had to experience before. The Star's mental health reporter Nadine Yousif joins me to talk about what this new poll reveals about empathy and sympathy and why our reserves are running out. Hi, Nadine. Nice to have you on the podcast.
Hi, Saba. Thanks for having me.
Nadine, it's kind of a really good time to be talking about empathy, isn't it? The whole world, I think, really needs some of that right now.
Yeah, thinking about the pandemic alone, the last 18 months were really hard. There was a lot of loss of income, loss of loved ones, loss of our lives and routines as the entire world around us shut down. But even if we step outside from the pandemic, the news cycle is just really heavy right now. You see a lot of stories about climate change, wildfires, the adverse effects of that. There was the recent earthquake in Haiti. There's always stories about the rise of xenophobia and racism, even when we look at what's been unfolding in Afghanistan and with the Afghans that are desperately seeking to come to Canada or other places for safety. It's just a lot to handle when we look at the news cycle, and it can be mentally exhausting to think about all of the world's troubles at the moment. So empathy is a really big theme. Even when we're not living it, there's so much around us that we need to be sort of understanding and we are exposed to.
For sure, a very overwhelming time for us all. Let's get into the definitions a little bit. I see some confusion on this front sometimes. Can you talk a little bit about what exactly empathy is and how is it different from sympathy? Because many people sometimes use it interchangeably. And why is it so hard, empathy in particular?
So empathy is different than sympathy because sympathy, by definition, means feeling bad for somebody, developing feelings of pity or sadness for somebody's unfortunate situation. So, for example, saying, somebody gets into a car accident and saying, I feel bad for that person. That is just a really terrible situation that they were in. But empathy is a bit different because it's the act of relating to and understanding someone who shares a different set of beliefs than that of our own. So it's actually trying to put ourselves in the shoes of that person, and it requires a lot more cognitive work. It requires a lot more effort. And it's harder for us to extend it when we feel cognitively tired or worn out or burnt out. And because it takes a lot more energy, it's starkly different than sympathy.
So it's hard to put yourself in somebody else's shoes when your experience has been different from theirs, right? So that's probably one of the difficulties in practicing empathy, correct?
Yeah, absolutely. And this whole idea of bridging understanding, even if you don't sort of understand a person's point of view or where they're coming from or their life experience, and still, choosing to hear them out and understand them despite all those differences.
And I think the data in your piece also kind of speaks to that. Tell me more about this recent information that's come out. Has everyone sort of gotten tired and is losing their patience?
Yeah, so there was this recent poll that came out of Angus Reid, and it's of Canadians. And it was actually about whether Canadians felt sympathy for those who are unvaccinated if they were to get sick with COVID-19. Now, we know that COVID is a very serious illness. It could be deadly. And in cases where it's not, it has long-term ramifications. And so obviously, the question was to measure whether people felt bad, essentially, for those who chose to be unvaccinated and still got sick with COVID-19. And the results were quite stark. Basically, 83% of people who were vaccinated who answered the survey said they have no sympathy for those who chose not to get the COVID-19 vaccine and still gotten ill with the virus. And so, 83%. And then when you look at the broader number of people who were surveyed, whether they were vaccinated or not, 75% said that they feel no sympathy for those who choose not to get vaccinated and still get sick. So you could see the majority of people, just their patience sort of waning thin, and they can't seem to feel bad for people who find themselves in the terrible situation of being sick with COVID-19 if they themselves chose not to protect themselves with the vaccine.
Yes, and it's been particularly challenging with the stakes being so high, as most countries, including Canada, are getting into this terrible COVID fourth wave as well. And we've seen the news and videos of some people who might have been previously anti-vaxxers who've had COVID and have been in hospitals and have talked about regretting some of those choices. Does the report talk about medical professionals as well? They've been kind of struggling in all of this, right, to find an understanding of what's going on.
Yeah, so the poll itself didn't differentiate between whether people were surveyed were medical professionals or not, but we have actually seen in the broader discourse some waning levels of sympathy from medical professionals. So there's been, one piece in The Atlantic of a doctor in New York City sort of talking about how, her and her colleagues are really exhausted with seeing people still getting sick with COVID-19 when it could have been preventable had they gotten the vaccine. There was another op-ed in the Los Angeles Times of a doctor who was actually talking about a personal experience recently of treating a COVID-19 patient in the ICU. And that patient was somebody who chose not to get vaccinated. And still the doctor tried her best to take care of the patient and give him all the available remedies that are there, given his circumstance. And the patient didn't make it. He died a few days later. And upon reflection, she's talking about how a case like this time last year, when we didn't have the vaccine that could, ultimately save lives, it really put a lot of toll on her psychologically and emotionally because you feel so helpless. I mean, you get into the healthcare system as a doctor, as a nurse, as a healthcare worker, wanting to help people and doing your best. And with COVID, it was something that we really had no answers, no sort of remedies, nothing that could work to prevent illness and death. And so when a vaccine becomes available and, scientifically proven to be effective in reducing deaths and reducing severe illness, I think, doctors are basically expressing their frustration and their waning sympathy and their exhaustion with, still seeing cases like this that are now preventable if someone had chosen to gotten the vaccine. So, we do certainly see it with doctors as well. But again, sympathy, like we said, is different than empathy. And I think healthcare professionals still practice empathy as much as they can, especially to bridge divide and understand why people are choosing not to get vaccinated at this time and how to help them make more informed decisions about their health and prevent, further illness and death.
We'll be right back. And like you mentioned, this is data from the report you're talking about. And it's also very telling regarding the sort of sharp polarization we've seen during this pandemic when it comes to the anti-vax movement. Does it seem to show that both sides are having less of a conversation with each other around this, and it's become sort of a more antagonistic place now?
Yeah. So, on the flip side of the Angus Reid poll, you had 82% of people who were not vaccinated and who chose not to be vaccinated, who said that they do have sympathy for people like them who are not vaccinated and still get sick with COVID-19. So when you take that figure against 83% of vaccinated people saying they have no sympathy, you can see that the two groups are struggling to reach a common understanding and are struggling to have conversations with one another about their decisions. And I think that, when I spoke to experts about why this is happening, one of the things that they said was, COVID-19 is something that's very personal to all of us. We've all been impacted by the pandemic in one way or another. We all know someone that's likely lost someone to the virus or know someone that's gotten sick. The lockdown itself was really difficult for many of us to grapple with. And so all of us are so anxious to get back to a life that is free of COVID-19 and free of this pandemic. And many people see the vaccine as the ticket to getting there and to healing from this pandemic. On the flip side, people in the anti-vax movement and the anti-mask movement, they see the vaccines as something that's infringing on their rights, on their freedom, and they want to have the freedom to make the decision for themselves, whether they choose to get the vaccine or not. And so it actually becomes more an issue that's tied to identity, less than a health issue and more tied to identity, the way that we view our world and the way that we view our future. And so it becomes more polarizing in that way. And it's hard for the two groups to come together and sort of reach some sort of understanding because it becomes very personal for us.
Right. And as you mentioned, on either side of the fence, everybody for sure is exhausted from the past year and the last few months that we've had. But in times of crisis, there's always this sort of challenge of trying to retain our humanity while under pressure or in survival mode. How important is empathy right now in this moment in history?
So, polarization is existing all around us. I don't think it's even just a pandemic thing or a vaccine thing. I think, sometimes when you talk about racism, discrimination, there's polarization with that. There's political polarization that's growing that's tied to these themes as well. And so, it is really exhausting to extend empathy, especially when we ourselves are not in a good place. And, the experts that I talk to that have sort of studied the psychological phenomenon of empathy is something that because it requires a lot of cognitive work, we ourselves need to be in a good place and have the patience and mental capacity to be able to extend that. A lot of us are worn out. A lot of us are exhausted, and feeling depleted. And it's not, instinctual for us to sort of still reach out that hand and reach out with that level of understanding when we ourselves are feeling so exhausted. And so that is difficult, but it's something that healthcare workers do try to emphasize a lot, especially. It is a core pillar of the work that they do to try to get people to make informed decisions about their health. But what we're noticing is, some of the healthcare workers I've talked to for the story, people that actually do a lot of work about vaccine reach out, for example, they found that extending empathy can be really helpful in terms of asking the right questions, having sort of active listening, and really understanding why some people are choosing not to get the vaccine. And, what some people are finding, or some healthcare workers are finding, is that some people are not getting the vaccine because they're sort of staunch anti-vaxxers or, align themselves in that way. But, some people are not getting it because of systemic barriers to healthcare, not having access to a family doctor, for example, that can answer very specific questions about health or how the vaccine may impact them, if at all. And so I think that what doctors are finding is that when they do ask the right questions and when they do listen with empathy, they're more likely than not to actually help that person make that decision and come to an understanding of the benefits of the vaccine and why it should be something that they should take. I think that, in general, another thing about empathy is sort of the understanding that no man is on one island alone. We all sort of share this community together, even when we don't agree with each other. So it's important to also bridge that understanding so that we can get out of the pandemic. We can heal and move forward. And if a certain smaller percentage of people choose to not get vaccinated and get sick with the virus, that puts a strain on our healthcare system, that puts a strain on our social services, our economy. And, these are all things that will impact us either directly or indirectly. And so this is why empathy is something that they really, really like to emphasize, even when it's hard. And it is hard to do in these times.
Obviously, no one can blame anyone for feeling the way they do right now. This pandemic has been devastating for everyone, and we've all gone through so much. But if someone, me for instance, we're thinking about this stuff, we're thinking, how do we build up on our empathy? Is there any advice from the professionals, not just on this issue, but in life?
Yeah. So, again, because it takes so much work from within, a lot of wanting to work towards building better empathy is actually working within ourselves to restore and rebuild ourselves emotionally and socially and get ourselves to a place where we feel like ourselves again. A lot of us don't really feel like ourselves right now. We're still dealing with the aftermath of the pandemic. We're still very much in it in some ways. And, with the fourth wave coming, so many people have so many questions about the future and, nothing is certain. And we're all still sort of on the edge, so to speak. And so, to get ourselves to a place where we can have the mental capacity to extend an honest and genuine level of empathy, we need to think about our own recovery, our own mental recovery and physical and social. And, the other thing too is exercising empathy is a choice and it takes effort and somebody has to be sort of willing to be ready to do it. It's also important that, while healthcare workers do use empathy as a tool to help bridge understanding and help make people make the best choices for their health and for themselves, in general, empathy, experts say, shouldn't be approached as a manipulation tool or as a way to get somebody to agree with you or to get them to change their mind. First and foremost, it has to just be a tool of understanding. A positive consequence of that, could be convincing somebody to make a decision that's good for them or that's healthy for them. But on the broader scale, that shouldn't sort of be the goal. It should just be coming with understanding. But, at the bottom line, nothing will change, experts say, unless we sort of extend that empathy. But there is the understanding that it's hard to do, and we need to do that work from within first.
Thank you so much for doing this, Nadine. It was very insightful to talk about empathy, something we should probably talk about more in times of crisis.
Yes, thank you so much for having me and for your interest in this topic.
I was speaking to the Star's mental health reporter, Nadine Yousif. That's it for today. Thanks so much for listening. I'm your host, Sabai Tazaz. The This Matters team is Adrian Chung, Brian Bradley, JP Fozo, Matt Hearn, Morgan Bucknick, Raju Mudhar, and Sean Pattenton. Our music is by So-Called, Mike DeAngelis, and Sean Pattenton. We want to hear what stories matter to you. Please send us comments, questions, or ideas to thismatters@thestar.ca. Please consider supporting the journalism the Toronto Star newsroom does at thestar.com/subscribingmatters. And don't forget to subscribe to This Matters on Apple Podcasts, Spotify, or wherever you listen to your favorite podcasts. Let's talk soon.